Welcome. My name is Tammy Schnocke, and I am a clinical education specialist at OSF Healthcare in Peoria, Illinois. I would like to welcome you to view our research poster presentation on the impact of virtual reality simulation in high-risk emergent situations in women's health. Postpartum hemorrhage is an obstetrical emergency and remains one of the leading causes of maternal morbidity and preventable mortality in the United States. To improve the quality and safety of women during all stages of pregnancy and postpartum, the Joint Commission and the Illinois Department of Public Health regulations require annual role-specific multidisciplinary education and drills, or simulation. Our organization seeks to ensure our employees receive the required education and competency validation in a robust fashion. We use vendor-led content from Relias to support the didactic education, and our organization also uses virtual reality simulation for micro-learning experiences, as this is more cost-effective than in situ simulation. Our study was a randomized controlled trial to identify if OB nurses who participate in a blended learning model of Relias OB assessment with learning pathways and virtual reality simulation have higher assessment scores and report higher levels of competence in responding to high-risk emergent situations than those nurses who complete the Relias OB assessment with learning pathways alone. So we had some exclusions and inclusions into the study. So the inclusions were the OBRNs, including new graduate nurses at OSF Healthcare, who had not yet taken the newly revised Relias assessment and associated modules. Exclusions were non-OB-RNs, RNs on FMLA, RNs outside of the healthcare system, student nurses, non-RNs, travelers, RNs who had already completed the newly revised Relias assessment with associated modules. We consented 75 participants into the study, 37 into the control group, and 38 into the intervention group. So what did we learn and what were the results of our study? So when we looked at the Relias knowledge and judgment scores, there was no significant difference found between post-knowledge or judgment percentiles between those completing the blended learning model and those completing Relias alone. Also, scoring above the 50th percentile in either category did not differ by groups. When we look at confidence, in those randomized to the blended learning model, data suggested confidence in responding to an OB hemorrhage event actually decreased after education and VR. You can see on the lower middle section of the poster, the left side is the control group confidence scores pre-experience, and on the right side is the confidence of the intervention group, where you can see their pre at the top of the graph and their post. No, their pre is at the bottom of the graph and their post is at the top of the graph. Upon further investigation, we believe the decrease in confidence may have occurred because after the education, participants became more aware of the risks of failing to respond appropriately in a high-risk emergent situation. Future research is needed to examine why there was not a difference between the two groups' knowledge and judgment scores and why there was a decrease in confidence. We are currently preparing to conduct a qualitative study with those into the intervention group to gain insight into why there was a decrease in confidence. This will inform our future use of VR and vendor-led content. At the lower right-hand portion of our poster, there is a QR code where you can scan the code and find final study data and resources to support the development of your own research study, along with our contact information. Thank you.